Before we get to your questions, we wanted to make sure you know about our CLF helpline. We provide personalized assistance and support to patients and families struggling with brain injury symptoms. So if you're looking for help choosing the right doctors, or if you have any other specific questions about your care, we are here for you. Our helpline also has a fantastic mentorship program. So if you're interested in connecting with someone who has lived with concussion, either as a patient or as a caretaker, please reach out to us. You can submit a request at concussionfoundation.org/helpline, which you see on your screen right there. We're also building a growing support community on Facebook through our PCS resources group. We'd love to have you join to connect with others experiencing concussion symptoms. You'll see a link to that group now in the chat as well, and it's up on your screen. So Dr. Robert Cantu is co-founder and medical director of the Concussion Legacy Foundation. He's also co-founder of the BUCTE Center. He's director of the Cantu Concussion Center at Emerson Hospital. He has authored nearly 500 scientific publications, including 32 books on neurology and sports medicine. He really needs no introduction to this group. We are so lucky to have him here as our medical director and as a resource for all of you on this webinar. Thank you for joining us, Dr. Cantu, and are you ready to answer some questions today?
Ready to rock and roll, Tyler. My pleasure. Glad to be here.
Awesome. Let's do it. Okay, so we're going to kind of go by category here, and as I said, we'll start with what folks sent in through email and social media. So, Dr. Cantu, I'm starting off with one on setbacks. Jan sent in a question. Do you believe you can have PCS 30 years after an accident? She said, I have classic PCS symptoms with cognitive function progressively getting worse, but in the UK, I just get laughed at for even considering the diagnosis. So 30 years later, could you have PCS?
Well, if you mean 30 years after the concussion and she completely cleared up from the concussion and didn't have any symptoms for nearly 30 years, and then 30 years later are starting to get progressive cognitive issues, then no, that's not post-concussion syndrome. There are very rare cases of post-concussion syndrome where someone may be symptomatic for a number of years. So far, I've never heard of 30, but it's possible. But those individuals have persistent symptoms. If you got over all your symptoms and then many years went by and now you're getting cognitive or other issues, no, it's not post-concussion syndrome. It could be related to the head trauma, though, that you may have taken at the time you had your concussion. But it's not technically post-concussion syndrome.
Got it. Okay, I'm going to move on to a question from Myrika. Can you help explain why recovery is like a roller coaster? My husband has some good days and some horrible days.
Well, I think one of the ways of looking at concussion is there's a metabolic crisis. There's also an issue with structural injury as well. But in addition, the biggest thing are cells that are injured. The great majority are alive. The great majority can recover. But there's a delicate balance between whether they're able to function or not. And those that are showing deficits are not functioning, but are alive. If you stress them, whether it be a physical stress, a cognitive stress, an emotional stress, or a sleep deprivation stress, that tends to upset that imbalance even more and can make the symptoms a great deal worse, and sometimes even add some symptoms that weren't there transiently. So it's not at all uncommon that based on sleep issues, stress issues, physical and cognitive exertion issues, that somebody recovering from post-concussion syndrome will have some days better than other days. And it's usually what's happened the previous night or the previous day that leads to what is then seen the following day.
I've got a question here from Michelle that kind of relates to that. Can you explain how it's possible to have a setback that lasts several months after only one day of overdoing it?
Yeah, it doesn't take a whole lot physically or cognitively to set people that are susceptible to that back. And so it's not uncommon if somebody has a moderate degree of symptomatology and then these stressors are put in place. that the degree of symptoms can go up. Sometimes even the degree of number of symptoms, especially those in the same domain of symptoms or same grouping of symptoms. It's basically the same physiology that's involved.
Yeah, okay. And a question here from Lizzie, also on that topic of setbacks. She said, when we experience a setback in energy levels, where our injury's original symptoms are heightened, is this new damage to neuropathways? Is it that our brain can no longer access new pathways? Or is our brain just getting overwhelmed? So she's kind of wondering about what can we do to prevent these setbacks, or are they inevitable?
Yeah, I think this is a great question. The overwhelming majority of people with concussion are going to have a metabolic injury that's going to be the biggest part of it. There are neurotransmitters that are chaotically released. They have to be put back on the nerve cell endings to work again, to transmit impulses. There are ions that are chaotically released as well. They have to be put back inside the cell, the sodium and the potassium that goes outside the cell. The calcium that goes inside has to be put outside the cell. The cell's not going to work metabolically till all of that has happened. And it is also true to a certain extent with a concussion that there can be structural issues as well. If the stretching is too great, there can be tearing of nerve fibers, there can be tearing of nerve cells. The structural injury is fixed though, at the moment that the concussion has happened. The metabolic injury is what can be influenced by whether one is stressing it further by cognitively doing too much, physically doing too much, by sleep deprivation, and so on.
Great. Question from Jen. She wants to know why she gets PCS flares from what seem to be non-concussive events, like sudden head motions or the smallest bumps to her head. She suffered a concussion in 2014 and fully recovered, but now her symptoms return after very minor instances. And I want to also mention, there's a question from Beth that's very similar. She said she has young children, and even sometimes the smallest knocks from them to her head can flare things up.
Well, I like basically the question very much because it reminds us that to have a concussion, you don't have to touch your head at all. And you don't necessarily have to touch it hard if you're very susceptible to concussions, like recovering from one. But there are concussions, not the majority, but the minority, maybe 10 to 15%, that just happen from inertial loading of the head. In other words, whipping the head forward because you took a blow to the chest, or whipping the head back because you got rear-ended in a car or hit from the back of your chest. So just moving your head rapidly moves the brain inside the skull. And that trauma of doing that can provide enough forces to cause a concussion. Unfortunately, when people are already symptomatic with a concussion, now they're really susceptible in most cases to that motion, and very susceptible, if they're still symptomatic, to the lightest of blows to the head, which normally wouldn't produce concussion symptoms.
Got it. I'm going to move on here to light and noise sensitivity, which a few different people had questions on. So one from Michelle: what evidence-based therapy is there for noise sensitivity? How can you overcome it? I'd like to understand how a concussion causes noise sensitivity.
We believe what happens with the issues with sensitivity to noise is that the cochlea, the end organ attached to the eighth nerve, the auditory nerve, and has hair cells that are involved with hearing, that they are injured, and that so that they're super sensitive to noise. There also may be some traumatic injury within the nerve itself. Unfortunately, we don't have good therapies other than noise reduction for people with difficulty with sensitivity to noise. So fortunately, noise reducing earbuds are easily obtainable today, and that's certainly the first line of treatment for these people.
Great. Question from Kristen. She said she's 6 years out from her concussion and says all of her PCS symptoms have improved, but her light sensitivity has actually worsened over time. I think on our previous webinar with you, Dr. Cantu, we talked a little bit about tinted glasses and sunglasses. For Christian, what are your recommended solutions for that light sensitivity that just hasn't gone away and has actually gotten worse?
Yeah, that's very atypical that a post-concussion symptom gets worse over time. And so I'd certainly want to be sure that she had a very detailed retinal evaluation by a neuro-ophthalmologist, that we're not dealing with something other than the concussion. Because generally speaking, with a concussion, unless there are stressors that we've talked about in the previous few minutes, post-concussion symptoms over time should not be getting worse. And certainly the other ones that have gotten better that she's experienced, that's the typical course. So what needs to be done really is looking first and foremost structurally that there isn't something else going on that's explaining why this is not only not clearing up, but getting worse, which is totally not expected.
Yeah. Question here on photophobia. How long does photophobia typically last?
Yeah, well, every concussion is kind of like a snowflake. They're all a little bit different. You can get a pretty good idea how long it's going to last by how severe it is. If when you have it, it's almost non-existent or intermittent, then probably not so long. And if you have it very severely, then there's more concern that it's going to last longer. But unfortunately, as is true of virtually all the other symptoms, it's very difficult to predict how long they're going to last.
Great. I'm going to take a question here that we may have covered in a previous webinar as well, but question from Jill, who says she's a vestibular trained physical therapist. And for folks, again, make sure you catch our webinar on physical therapy, which is on our YouTube page. What do you think are the optimal treatments for post-concussion syndrome visual sensitivity to screens and driving?
Well, here again, tints can be helpful. Most people, it's a blue tint, a blue plastic screen put over white paper with black print on it that helps them. In terms of computer screens, some people find the blue tint best for them. Others find an auburn tint, slightly reddish tint. Relaxes the eyes, allows them to have a longer period of time on the computer screen. There are a variety of tests, variety of exercises that can be given for individuals to help with this. The visual issues with screen are very different than the vestibular issues, which are a balance issue, but it's very common that vestibular or balance issues will also be present with eye tracking problems.
Great. I'm going to move on to a category here. We have a couple questions on imaging. So Sandra asks, is an MRI an effective test to diagnose a concussion? She says, I was told you need to be diagnosed within 24 hours after a head trauma or conclusive concussion diagnosis cannot be determined.
Well, unfortunately, routine MRI is not able to diagnose a concussion. Concussion is a microscopic injury to nerve fibers and nerve cells and a metabolic injury to nerve cells. It is not a macroscopic injury that we can see on a routine MRI or a routine CAT scan. So we get those studies sometimes when symptoms persist, and we get them sometimes right away when symptoms are worsening because we're worried about other conditions that could be life-threatening, like an intracranial bleed, but we don't get them to help us diagnose a concussion.
So the most important thing for someone who just got a concussion or whose child just got a concussion, would that still be make sure to go see a medical professional? Imaging can't take care of it, but that, that evaluation needs to happen.
Well, I think the evaluation does need to happen, certainly if the concussion symptoms are significant in terms of number and severity, and certainly if they're getting worse, any of the symptoms, then it's very, very important that they be seen sooner rather than later.
Yeah. Question also relating to imaging from Nancy. Any tips about how to go about getting diagnostic images for an MTBI? The neurologist I saw is reluctant to order a DTI and instead has ordered a 3T MRI. The neuropsychological exam showed some cognitive problems.
Yeah, well, there are research studies or research modalities for the MRI, such as diffusion tensor imaging MRI, which has actually been around 20 years and is beginning to be used a little bit clinically, but is not routinely used clinically. And there are other uh, MRI studies that are really in the research category, and those include functional MRI and PET scanning MRI. These are actually studies that do show structural or metabolic changes with concussion, but these are research tools. They're not tools that are generally in the clinical domain. So most hospitals would not have them available for you.
Got it. Got a science question here from the chat from Maleka. Where do the stretching of axons occur? Is it deep in the brain, or is it at the juncture of gray and white matter?
The greatest stress is at the gray matter, white matter junction. And that is where you see the majority of the microbleeds that can be seen on a special modality of MRI called diffusion weighted imaging MRI, the individual microscopic little dots of bleeding. I'm calling them microscopic. They're really not microscopic. They're macroscopic because we see them on an MRI, so they have to be bigger than microscopic. But yes, that is where the greatest stresses are in terms of the nerve cell and the axon. Then the axons themselves, in terms of which ones are most likely to be disrupted, the longer they are, the longer the path they have to go, the greater the chance there's going to be disruption. So that our longest pathways, those that go from the front to the back of the brain, those that go from the right side to the left side to the right side, the longer it is, those are the ones most likely to be structurally torn. And in time to show up having atrophy in those bundles.
Got it. Great. Thank you. Question here from Erica. What advice or suggestions do you have for pregnant women with PCS, both during pregnancy and postpartum? Erica says she's had PCS for about 14 months and still struggles with cognitive, emotional, and physical endurance.
Now, this is a kind of an area where we don't really have solid science in every instance to give the best answers. But generally speaking, while somebody is pregnant, obviously the pregnancy is a stressor, just like issues with sleep, physical issues, cognitive issues. The metabolic issues of the pregnancy, the over demands of the woman's body, this can make concussion symptoms worse. And so you're going to be very careful at this point. You're not pushing somebody very hard through physical therapies or ocular therapies or cognitive therapies. You're always worried about overshooting. On the other hand, there are metabolic changes that happen very abruptly when the child is born. Those metabolic changes in a small percentage of individuals can lead to postpartum depression. So if depression is a significant problem with the concussion in terms of post-concussion syndrome while you're pregnant and now it's worse afterwards, it becomes difficult to kind of untangle how much of that is possibly postpartum depression versus post-concussion syndrome. You wouldn't think that the post-concussion syndrome would be worse after the pregnancy. You'd be thinking more likely that it's related to the postpartum syndrome.
Just because you touch a little bit on the metabolic damage there, Dr. Cantu, we have another question from Laura who said simply, how do you repair the metabolic damage that comes from a concussion or PCS?
Yeah, the good thing is that the metabolic injury, I think if I use the word damage, I don't really want people to be thinking of it as damage because the metabolic part of concussion in most cases is totally reversible, as opposed to the structural damage where axons are actually torn and or nerve cells themselves are torn. But if the metabolic demands are way excessively too much, especially very acutely in the first days after concussion, we worry that the metabolic insult can actually cause some cells to die that wouldn't have otherwise died. But normally, the brain heals itself in terms of the metabolic issues. The sodium, potassium that got squirted out of the axons into the extracellular space and out of the neurons into the extracellular space is put back inside the cells. It takes energy, but the axons have a pump called the ATP pump, which is the energy pump, and it pumps the potassium and the sodium back inside. It causes the calcium that came in to be deposited back outside where it belongs. It puts the neurotransmitters back on the end of the nerve axons. And so after a period of time that varies in each individual situation, you can now again have metabolic connectivity from these nerve cells through their axon onto the next cell, onto the next axon, next cell, so on.
Great, that's so helpful to know. I have a couple questions here on emotional and behavioral sort of result and symptoms from concussion. We know those can come up. Lisa's asking, can PCS affect personality years later?
Once again, I think it's really important to understand post-concussion syndrome means persistent symptoms after your concussion. So if you had behavioral or mood or dysregulation symptoms that were persistent from the time of your concussion head injury, then technically, yes, you could have them lasting in a very small percentage of people years later. But if I think this is what you're dealing with, namely that those symptoms all cleared up and now years later, you're having those symptoms, no, that's not post-concussion syndrome. Could it be related to repetitive head injury that you took if you played collision sports over a period of years? Or could it be related to injury that was occurred at the time of the concussion? It's possible, not real likely unless that repetitive head injury was an awful lot. But if it was, then we'd be more worried about neurodegenerative disease processes like chronic traumatic encephalopathy. If there wasn't a really high load of exposure, for instance, in football, greater than 10 or 11 years, we call a high load. 5 to 10 years is moderate, not terribly serious. Under 5 years is almost, we don't even think about you being at any kind of increased risk at all. On the other hand, if you were not at risk because you didn't have that kind of high exposure and you were having cognitive, behavioral, mood issues, then we'd have to be thinking about other neurodegenerative disease processes that might be there. And you'd want to have Alzheimer's ruled out and other things if cognition was the major issue.
Got it. Another question on behavior. Ken wants to know if you have any insight on what's the best method to stop spontaneous anger that can be triggered easily.
Well, issues with anger, short fuse, impulsivity, very common after concussion. We think it's mostly medial temporal lobe and the limbic system is involved with that. Pretty much, as is true of other constellations of symptoms, cognitive symptoms, ocular symptoms, whatever, balance symptoms, we start with the therapist. We start with the therapist working with the individual one-on-one. And then if that's not adequate, we go to pharmacy. And there are medications that work specifically to make you less likely to not be able to control your mood and your behavior and have this short fuse. Certainly, we often will start with anti-anxiety type medications. Escitalopram is one that it's used quite a bit. Nudexa is also one that can be used for these individuals which have a very short fuse impulsivity.
Great. Question here from Diane, getting into the neuroendocrine system. She says she wants to know if a TBI can affect the pituitary gland and the central brain. She is 73 and having many hormonal changes.
Well, the answer is yes, it can. The most and it can happen from a brain injury like a concussion. It is more likely to happen from a very severe brain injury in which there's been intracranial bleeding and the forces that were involved were a great deal greater than a concussion. But the pituitary gland sits in a little bony area at the base of the brain and has a somewhat vulnerable blood supply. And when the brain whips back and forth and this thing is stuck in its little bony vault, so to speak, called the sella turcica, the blood supply can be stretched and compromised. And as a result of that, various different hormonal insufficiencies happen. The most common of them are growth hormone, but others that can happen are thyroid stimulating hormone can be diminished and lead to hypothyroidism. ACTH can be diminished, leading to hypocortisol in your blood and difficulties with hypoadrenalism. The other common one for men is testosterone can be reduced. And this is very, very important. It's a great question. It's a very important thing to have worked up because there are blood studies which can tell you in a screening way if you have deficiencies or in these areas. And then there are provocative blood studies that can be done that require a physician to be present at the time they're done that can definitively find out whether someone is truly deficient. And if they are, it's great to know because it's very, very, in most cases, easily correctable with hormonal replacement. Testosterone in the case of obviously hypoadrenalism, levothyroxine for hypothyroidism, so on.
That's great. That's a really good primer on this topic of pituitary gland and neuroendocrine. I want to point out a couple things. One is that we do have a section on our website, concussionfoundation.org/PCS. If you go to our treatments page, we have a section there on the neuroendocrine system. And I want to let everyone know, July 22nd, we'll have a webinar focusing on this exact topic. So please sign up for that. And Julia, Brandon, if we can add that in the chat right now so folks can sign up. But it's a really interesting topic. And that's a great primer on this for future learning for folks who are interested. A couple of questions here, Dr. Cantu, on medication and treatments. Obviously, this will be case by case and, of course, consult your doctor, but I think there's some good questions here to give people an idea. Lizzie asks, is fasting or intermittent fasting good or bad for someone with PCS?
What is bad for someone with PCS and what is bad for someone without PCS, but not nearly as big a problem, is hypoglycemia. So you don't want to get hypoglycemic, and depending upon your own body, when you fast, you may become hypoglycemic. Most people don't become severely hypoglycemic, but in post-concussion syndrome, you can have aggravation of symptoms without becoming severely hypoglycemic. Normally, for a normal brain, without recovering from any injury issues, you have to be quite severely hypoglycemic before you have residual symptoms from it. But generally speaking, therefore, I wouldn't take the risk. And I think it's better to have more meals that are smaller than 1 or 2 meals that are spaced out greatly over the course of the day. I realize there is this trend now of trying to eat all your meals within 8 or 10 hours or 12 and then fast the other 12. While recovering from post-concussion syndrome, I would say that's your major priority. I wouldn't be worried about the fasting.
Great. Question here from Alan, and you did just mention some testosterone and hormonal levels being affected. He said, what are your thoughts on taking HGH and testosterone? Alan has found it's the only combination that allows him to exercise and stay strong.
Yeah, normally we wouldn't be prescribing both. Human growth hormone is definitely prescribable now, but it's normally used for youths that are short of stature and their bone plates are still open, and you're worried about them being very short. So we use human growth hormone, which fortunately now is synthetically made, so it's totally safe. You don't have to worry about viruses from other animals that the growth hormone was extracted from their pituitary. But generally speaking, if we use testosterone, it works very similar to growth hormone. And so we probably wouldn't be using both of them in the same individual. Now, if somebody is absolutely certain that this combination is far better than just testosterone alone, depending upon the levels of growth hormone being given, it could be safe, and it might in an individual circumstance be used in conjunction, but generally we don't.
Great. Question from Scott. He wonders if you have any recommendations for taking low doses of ketamine or propofol, also on cannabis or something like a harlequin strain of high CBD.
Well, that's a great question. I wish I had definitive answers to all of the parts of it. Ketamine is normally used to treat depression or major depressive disorder. So if, as part of your symptoms, you're heavily into the emotional symptoms and depression and mood issues are a very prominent feature of it, and they're not responding to being seen by a therapist working with you, the case certainly could be made that ketamine, it's not normally the first one of the antidepressants we use, but it certainly could be made to be tried. Certainly try it if others haven't worked. And if it's working, I would say go with it. Propofol, on the other hand, is an anesthetic. There are rare side effects to that can be life-threatening. I'm not aware that it is useful in post-concussion syndrome. I would have to better understand what the physiology is even theoretically, but without some solid science behind it and knowing that it rarely has fatal implications from its use, although fortunately it's rare and it's a very common anesthetic. But I would not normally be prescribing or supporting its use. The harlequin strain of marijuana, I wish I knew the answer to, because in theory, it's got a lot going for it, because it's kind of a hybrid type of marijuana in which the THC part of it, the part that produces psychotic ramifications, cognitive issues, is low. And its major effect, so they say, is relaxation and calming and pain relief. And those are wonderful things to be using in individuals that have those problems. And because of the relatively low THC, most people don't get a quote unquote high, and their alert and judgment and all those issues are not impaired. So if marijuana is going to be used, that strain of it does have a lot of theory. On the other hand, just CBD alone is felt to be useful also for its calming and relaxing benefits, and its pain relieving benefits, and its anti-inflammatory benefits. It's really kind of sad that here I sit with all of these years in this area, and marijuana just hasn't been studied the way it should have been studied. And it's only now that these studies are being done, and we just don't really know the answers right today. But that strain's got a lot of theory behind it if you're going to use medical marijuana.
Yeah, good answer. Thank you. Question from Carrie. She said she's 4 months out from her concussion, where she also fractured multiple bones in her and injured her trigeminal nerve. She did PT for a few months to help with dizziness, but just started doing electromagnetic pulse therapy, and that pulse therapy has helped tremendously. She wants to know if she should continue with PT, sort of one of those questions on multiple therapies at once?
Yeah, generally speaking, I'm not a big supporter of multiple therapies at the same time, because then you really don't know which one is acting and which one is really helping. So if the PT did not, and I assume what she's talking about PT is vestibular therapy, not just PT to the neck or physical therapy as an exercise program per se. If this has not helped, and she's quite certain that she has received the benefit from the electromagnetic pulse therapy, I'd say go with it for a period of time at least. If the improvement tends to taper off and the dizziness is still fairly significant, then I would want to be sure that when she says PT that she's really been through the proper vestibular therapy.
Great. One more question for you on metabolic changes, Dr. Cantu. Austin wrote in, what medications or therapies are available to attempt to normalize metabolic imbalances in the brain? And are there any diagnostic tests to determine specific metabolic imbalances?
Well, there aren't specific tests that I'm aware of for the brain per se. There are obviously metabolic tests that can be done in your blood in terms of whether there are issues, generally speaking. And there aren't therapies specifically directed toward that.
Got it.
In terms of the brain.
Yeah. A question from David as well. Have you come across ocular-micro tremor and its utility as a biomarker for MTBI?
Well, there are now a number of different platforms using goggles that look at your pupils and look at your eye tracking when you do your smooth pursuit, when you do your rapid saccadic eye movements. And they're able to track it probably more accurately than we do with our eyes, just having somebody go through smooth pursuit and saccadic eye movements. So the answer to that is yes, there are abnormalities that are very common after, in terms of eye tracking abnormalities that are very common after concussion. They give rise to a variety of symptoms, usually blurred vision. Also, it can be vision where you can't look up close nearly as well. Convergence is often impaired in those situations as well.
Great. Question here from Jerry. He said, my son's concussion was in May and he still suffers from short-term memory loss. Besides cognitive therapies, what other therapies might be worth trying?
Well, normally the cognitive therapies are what we would use for cognitive issues. Need to be very careful and certain that he doesn't have any depression, because that can adversely affect our cognition. But if he's purely with short-term memory issues and there are no emotional issues, nothing else going on, I would personally in that situation then try stimulant medication, neurostimulant medication, starting with the methamphetamines, and if necessary, going on to other neurostimulants as well.
Yeah. Question here from Diane. She says, I've dealt with chronic dizziness after multiple concussions in the last 5 years, and I still find it difficult to find words I'm looking for at certain times. Are there any potential treatment options to deal with that? And will it get worse in time, or could it get better?
Well, those are very common cognitive symptoms. It's a great question. Very common cognitive symptoms that are expressed after a concussion. You have trouble finding the word that you want to express. You know what the word is in your mind, but you just can't get it out. You just can't fixate on it. There are therapies that are helpful for that. And once again, as with other cognitive symptoms, memory issues, neurostimulant medication with methylphenidate in varying doses, either short-term or timed release capsule, can be very useful in those situations.
That's great. I have a couple other of the questions that came in via email, and then we'll try to take a few more from the chat as well. One here from Melanie. It seems that many medical professionals have varied knowledge about concussions. How can patients advocate for care when medical professionals don't provide support or what they're looking for?
Well, I think it's important that when you're having issues related to a concussion, that you see somebody that's kind of their focus, that's kind of their area of expertise. And if that individual doesn't have the ability to demonstrate that by either what meetings they have gone to or what area of specialization they're into, et cetera, you may need to go to somebody else. And it's just a reality that doctors are getting better and better across the board on this issue. Primary care and pediatricians are hugely more advanced, I believe, today than they were even 10 years ago. But still, especially for, not always, but individuals that were trained before concussion was part of the curriculum in terms of their training, and certainly not very much emphasized. These individuals, if they've been out for 15, 20 years and they haven't picked up on this, may not be the person that you want to stay with.
Yeah, one thing I'll mention as well for Melanie, one of our website pages, concussionclinics.org, has a clinic finder in there. But what I want to mention is that we have a PDF on that page that has 5 tips for choosing a concussion clinic. And a lot of that relates to what Dr. Cantu was just talking about, what you should be looking for in terms of a clinic or even a specialist, their expertise. It's an important part of that process is really finding that right doctor.
Correct. Absolutely right.
A question from Joseph here. What do you think about the future of high school football? I think this is a non-COVID related question. What do you think about the future of high school football? Will the sport go away? Joseph wonders because he's been seeing a decline in team size in St. Louis because of concussion and CTE concerns.
I have great hope that it will not go away. As much as I want to see at the young levels, individuals not taking those hits to the heads, and by the very young, I mean under high school. And I want to see them playing flag football. I want to see them playing soccer without hitting, without heading. I want to see them playing ice hockey without full body checking. But by high school, if you're going to want to play that sport, you're going to have to be playing that sport. Now, we do want to reduce and minimize the amount of head trauma. And I think the amount that kids have taken in the past is unacceptable for the future. But I think we can dramatically reduce the amount of head trauma that they take. Not so much in games, because in gameplay, it's pretty tough to, even with proper technique, to totally take the head out of some contact. But you can almost eliminate head contact in practice. And that's where 60 to 70% of the current contact happens, just because practice is so much more. There are practicing drills that can be done without head contact. There are practices that can be done without helmets, so you're not going to use your head. There are mannequins that can be used instead of tackling somebody and possibly hitting your head, using a soft mannequin or tackling dummies. And also just simply the amount of full padded practice should be tremendously reduced, and I think can be. In the National Football League, not everybody realizes that full padded practices, a contact practice, can't even be held once a week, once the season starts. By the collective bargaining agreement, it can only be held 14 times out of 18 weeks. Most teams don't even hold 14 full padded practices once the season starts. In the Ivy League, well, there isn't going to be an Ivy League this fall, but when there is an Ivy League a year from now, hopefully, there will be no full padded practices once the season starts. There's no full contact practice once the season starts. And it's because you can substitute other drills for that. The most effective of all of them, I think, is what's called the thud drill. And that's where you use game speed tempo. You're fully suited up, but the individual who's making the tackle puts their arm around the person, but then immediately releases them. Or helps them not go to the ground. The whole idea being you don't tackle anybody to the ground. Nobody goes to the ground. And with that, you use game tempo, game speed, you get the skills, you just don't wind up bashing heads and hitting heads into the turf.
Yeah, that's great insight. And I will plug the tremendous book that you wrote, Concussions in Our Kids, because even though it was years ago, that touched on a lot of those topics of how can we protect, especially the youngest and most vulnerable brains. And likewise, our Flag Football Under 14 campaign advocates for those same messages.
I was talking with Chris today, as I think you know, the CEO of Concussion Legacy, and he was telling me and showed me a release from the CDC that shows a very significant reduction in concussion over the last 6-7 years, and they attribute it to be mostly individuals not playing tackle football, starting tackle football at a later age, and to a certain extent the limitation of practicing. But clearly, you can greatly reduce the amount of trauma you take if you start later.
Yeah, very well said. One other question that came in through the chat that relates to team sports, and this isn't necessarily your job, Dr. Cantu, but you're so tuned in to team sports. I want to see what you think. Carly was asking, what's the best way to educate coaches and athletic trainers who are unaware, especially of post-concussion syndrome, and what athletes go through in terms of those long-term symptoms? How can we educate those who are with the athletes every day?
Well, I think what you're doing, Tyler, and what Chris is doing and Concussion Legacy is doing is trying to play a very significant role in that. You're doing it not only straight on, providing educational forums such as we're doing today, but you're doing it through teaching the broadcasters to not glorify hits and recognize as best they can from the booth what might be signs of concussion. So I think that the key thing is education. Now, technically, all of those people you mentioned theoretically are getting and are required to get education on concussion and post-concussion syndrome on a yearly basis. Unfortunately, that education is not something that's followed up in terms of no state that I'm aware of has any examination on whether or not they absorbed any of the information that was theoretically presented to them via video or whatever else. So they could have been planning the next scrimmage, they could have been on their cell phone, whatever, when the video was shown or the lecture was given. I think that's something that hopefully will change in the future. I think most coaches, athletic trainers, clearly do care about the kids. Most coaches are not overzealous and want to do the right thing. And I think if given the information, they will. But getting that information to them is not always a terribly easy process.
Yes, totally agree. This is a really cool question, I think, from Allie. What is one thing you wish every concussion patient knew?
Well, probably the most important thing to me is that every concussion patient knew that either physical or cognitive exertion can exacerbate their symptoms. So that has to be titrated. But we do want them to be as cognitively exerting and physically exerting after the first 48 to 72 hours as they can without provoking symptoms. Number one. Number two, just generally speaking, the evidence is overwhelmingly accumulating of the benefits of exercise in terms of not only helping recovery from post-concussion syndrome, but even helping cognitive issues and stave off cognitive issues as we age. So I would like all of these individuals to be as physically active as they can and beyond a tailored exercise program. One that's not at the level that it's provoking symptoms getting worse, but definitely there. and progressive.
Yeah, and I had a related question on that here in the chat. What advice do you have for exercise with PCS, especially right now, given that access to gyms and pools is challenging? What's the best form of aerobic exercise or that sort of light exercise ramping up?
Yeah, it's a great question. It depends a little bit on the severity of symptoms and how many symptoms and how close to your concussion. But generally speaking, we like not to start with ballistic types of exercise. Exercise that rapidly changes the direction of your head. Exercise that causes the brain to shake inside your head. So we wouldn't be doing anything where there's jumping. So there wouldn't be any basketball, one-on-one, anything like that. Rather, we would start with no impact to low impact exercises, like on a treadmill, incline it, but walk, a stepper, an ellipse machine, a stationary cycle. You can progress from that to very light, if you can progress from that to very light jogging, great, super. Go from very light jogging to a little bit more intense. 3 parts of all exercise programs involve how long you do it, how hard you do it, what the intensity of it is, and the volume of it that you're doing it. Not just the number of minutes, but how much distance you're covering. And you want to go up very slowly in all 3 of those. But the thing that we like to increase last is the intensity. So we stretch out, starting people on 15, 20 minutes of exercise. If they can do that at a low intensity, a low heart rate, 120, 130 or less, if whatever it is that we have to stay under to not provoke symptoms, we go out further in the time before we start to significantly increase the intensity. And then the last thing to ramp up is the intensity. And that intensity is what's going to be correlated with driving your heart rate up much higher as well.
Great. I have a question here from Janet, and we have time for just a couple more. I don't think we're going to get to all of these in the chat just because people are asking so many good questions here. So again, thank you very much to everyone for all your engagement. Questions. Great. So a question here from Janet. She said, my son has had 5 concussions. He just turned 16. The last one caused some cognitive issues with schoolwork. Anything that was multiple steps caused confusion for him. He says he's fine now and wants to continue with competitive sports. How do you know it's safe? And I know you've had this conversation with a lot of families, Dr. Cantu. What do you talk through with those families?
Yeah, first of all, I think the most important thing is what sport is he playing? Is the sport at risk, high risk for concussion? Say it's football. Well, if it's football, then it is very high risk of concussion. How passionate is he about playing this sport? Does he have other sports that he plays that he might use and not necessarily feel so terrible about not playing football? So I think those kinds of conversations happen, and be surprising how many times I find that the kid himself, and we don't always ask these questions in front of parents because we kind of want to get an independent answer. And sometimes the answer can be different in front of dad. Sometimes it can be different in front of mom, but more commonly dad. But to make a long story short, if we're going to return a kid with multiple concussions to a sport like football, then I think we're going to be wanting that kid to be absolutely passionate about playing football. We would prefer that kid be pretty good at playing football, not just cannon fodder for people that are bigger, stronger, faster. And we want to be absolutely certain that the concussion, the most recent one, had been quite far in the distant past. If he's had a number, 3 to 6 months is usually what we use, although it will vary with the individual. And if there is any question that the individual may not have completely recovered, as is being suggested here, he's possibly still having some cognitive issues, then I think some formal neuropsych testing of cognitive function needs to be done. At the very minimal, it gives you a baseline to compare against in the future if you have to. But if it shows impairment, then you're just not going to be recommending this individual goes back. That testing is somewhat limited though, because you don't really have this individual's own baseline. If he was a genius and he's now 30% less, he'd still score in the high average range, and you wouldn't know that if you didn't know how gifted he really was.
Yeah, that's a really helpful answer. I want to also mention, from a parent perspective, for Janet, we had a really interesting webinar with parents maybe a month ago, and a family, the Capel family, dealt with this exact thing with their son. So Brandon and Julia, if you guys can find that link, I think Janet would probably appreciate watching that video, because they talked through their decision process of, do we put him back in, or do we hold him out because of this latest concussion? And Julia, right on cue, just threw it in there. So thank you. I would definitely recommend checking that out, Janet. All right, we'll have one or two more here, Dr. Cantu. A question on COVID here. As we learn more about COVID, this is from Julie, we're finding out that it affects multiple organ systems in some people, including the brain. Would having a history of brain injury or post-concussion syndrome put an individual in a high-risk category for COVID, or do we not necessarily know that yet?
Yeah, it's a great question. I don't think we really know that, but what we do know is that if you have had a brain injury, like a concussion, some people are going to have some structural injury from that is not even detectable performance-wise, but their reserve of brain tissue in those areas will have been diminished. So if they were to have another injury superimposed on it in the same injury, like the hypercoagulability that we believe is happening with some people with COVID, that explains the rash and the lesions in the toes that are causing amputations and causing some strokes, we think. Yes, it could be additive. As of today, I'm not aware that post-concussion syndrome is quote unquote a high risk, but I would put it in that group to be on the conservative side.
Lots more to learn, as we know.
For sure.
Question here from Molly. Why does stress bring on my PCS, and what are strategies you would suggest to help with stress?
Yeah, stress causes the body to be hypermetabolic, and it's that increased metabolism that stress produces that is causing the aggravation of the metabolic demands that are already there from your concussion. What you need to do is try to work on anti-stressors. At one extreme and last extreme would be anti-anxiety medications. I would never start there, but that is way to the right if everything else fails. What is useful for many people far short of that? Well, you can start with meditation, hugely beneficial for many people with PCS, especially those that have anxiety issues, panic attack issues. Mindfulness, that whole concept is also beneficial. So that what you need to do is work on activities that allow yourself to just kind of throttle back and gain control of your emotions. And that's where a therapist can be very, very helpful for you. It's also true that most people wind up having a relaxation effect from physical exertion. And I don't mean extreme, but I mean just physical activity. So that would be another additive thing that we would put into the toolbox of things that we would be prescribing as quote quote, medicines for an individual that has PCS that's being aggravated by stress.
Great, thank you. That's very helpful. I think on that note, we are going to call it. Thank you so much, Dr. Cantu. Folks, if you want to give Dr. Cantu some love in the chat here, he did a tremendous job. Any final words, Dr. Cantu, for the patients, the caregivers, the families that are working through their concussion symptoms?
No, except for the fact that you will get better. You will get better over time. You'll get better faster if the appropriate therapy and the appropriate concepts are followed. And a few of you may need some medication. It won't be many. It's a minority. But these were just absolutely great questions today. So I'm very impressed, and I was happy to be here, Tyler.
Fantastic. We may have to rope you in for a part 3 to finish off the rest of them.
A trilogy.
Yeah, exactly. All right, I'm gonna turn off Dr. Cantu's video here, and we have a couple more messages for you folks. So I just want to let you guys know, if we didn't get to your question today, or if you're looking for specific support, remember you can reach out to our CLF helpline, and you can see that URL on your screen right now. I also want to make one note on the helpline. I know we had a lot of guests from Canada today. Thank you guys for attending. I just want to say the CLF Canada team has been working really hard on the resources that they have for their helpline up above the border. So please don't hesitate to reach out through the helpline if you are from Canada and are looking for help. We've got a team specifically dedicated to try and find you the support that you need. And certainly don't forget to sign up for the next 2 webinars in our summer concussion series. Next Thursday, Dr. Len Mesner will join us to cover the impact of concussion on vision. And then the following Wednesday, as I mentioned earlier today, Dr. Tamara Wexler will cover neuroendocrine dysfunction after concussion. The links to register for those webinars are going to be in the chat momentarily. We hope to see you there.